Hey guys, it's Megan. I'm going to talk to you about the basics of burn care. So let's start with a little bit of a review. There are 4 degrees of burn, depending on the depth of injury. First degree or superficial is just your typical sunburn. It hurts, fairly uncomfortable, but it doesn't cause any long term damage due to only having the effects on the epidermis. Second degree is broken up into 2 subcategories: superficial partial thickness and deep partial thickness. Second degree partial thickness begins to go superficially into the dermal layer of the skin. It's characterized by being very red, being blanchable, and having blisters. It's also very painful. Second degree deep partial thickness goes deep into the dermal layer. These burns may be yellow or white in color and may or may not have blistering. The difference between the 2 types of second degree burn is that the deep partial thickness may not always be painful, but the patient may feel pressure instead. There's also less blanching when there's an assessment done. Third degree, or full thickness, extends fully through the dermis. These burns are characterized by a white or brown color. There's no blanching, and it is leathery in appearance. Third degree burns are also painless to the patient due to the damage that is done to the nerve endings with the injury. Finally, fourth degree extends through the skin into the muscle, fat, and bone. These burns are charred and dry. There's no pain, and they require surgical intervention. Limbs that have fourth degree burn typically require amputation, and trunk burns typically require escharotomies. So let's talk a little bit about wound care now. So the basics for any type of burn is focus on keeping the area moist and clean. First degree burns are pretty simple. It's just topic analgesics such as aloe are helpful during the acute phase. Second degree superficial requires deroofing or popping of the blisters for the removal of the damaged skin. Skin is usually washed with a baby shampoo or some type of antibacterial soap to debride the skin away. Doctors or nurses do this in a controlled environment to prevent the possibility of further infection. Because there aren't typically blisters for deep second, there isn't any deroofing that needs to happen, but the dead and damaged skin still needs to be removed, and this is done the same way as a second degree superficial. Third degree requires similar treatment as deep second in respect to how they're washed. Some third degree burn requires skin grafting, which is at the discretion of the surgeon. Fourth degree, as previously mentioned, typically requires amputation. Second and third degree burns are dressed in the same fashion. After being washed, they have polysporin ointment applied in an even layer. They're covered with an antibiotic gauze, which in my hospital we use Zeroform. Zeroform is a normal gauze, is covered in a normal gauze and covered with a dry dressing. For the limbs, they are wrapped in a figure 8 pattern with the Curlex, then wrapped with ace wraps, also in a figure 8 pattern. For the trunk, you have to be somewhat creative in how you cover it. Other wound considerations are that facial burns are cleaned the same way as a second and third degree, but the biggest difference is the only ointment used is just plain Vaseline. Circumferential, or burns that wrap completely around a limb or chest, may require a surgical release by an escharotomy. Think of a fasciotomy for release of compartment syndrome, but this is for the limbs. And the trunk is caught in a large W pattern to release that muscle underneath. So pain control. Pains are very painful. Your patient is not lying to you, so believe them. Needs to be treated appropriately. The most common treatment for burns is via narcotic medication, typically such meds as Dilaudid, morphine, fentanyl. Some patients who have a more extensive surface area burned or may require the use of a PCA, or a patient-controlled analgesia, so that they can administer their own medication as they need it. These patients might also require anxiolytics due to associated anxiety, and keep in mind to bolus the patient prior to ambulation or wound care, because that's the most painful part for them. The American Burn Association, which is the mecca of burn care and research, stated that 486,000 people sought medical treatment for burn injuries in 2016. I know this seems like a lot of information, but these are just the basic ways of caring for most burned patients. I hope you enjoyed it.